very warm welcome to LSTV Report. In this program, we bring you the analysis on the contemporary issues. 2020 is soon going to end under the shadow of global pandemic COVID-19. Hundreds and millions of people have lived through lockdowns. The future looks uncertain. We don't know when or if our societies might return to normal, or what kind of scars the pandemic will leave. India too has been adversely affected by the pandemic. As the second wave of the pandemic has taken roots, it is time to assess the current situation. In this report, we will assess the current strategies taken by India to fight with the virus, what are the possibilities of getting the vaccination, and the future ahead.
This is SARS-CoV-2. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily on throat and lungs. The world is going through a massive war, a war with this viral infection, coronavirus. The coronavirus pandemic is the defining global health crisis of our time and the greatest challenge the world has faced since World War II. On March 11, 2020, WHO declared novel coronavirus disease or COVID-19 outbreak as a pandemic and reiterated the call for countries to take immediate actions and scale up response to treat, detect and reduce transmission to save people's lives. With over 8 months now, public experts have warned that highly infectious coronavirus disease 2019 or COVID-19 has the potential to re-emerge and produce a second or possibly even third waves of disease. As November 2020 dawns, a second wave of the COVID-19 outbreak seems to have created havoc in European countries, with France and Germany moving towards a renewed lockdown in the view of resurgent coronavirus cases. French President Emmanuel Macron and German Chancellor Angela Merkel ordered their countries back into lockdown. The countries affected again includes Britain, Spain, Russia, Germany, US, Belgium, UK, France and Italy.
Nous aurons en milieu de semaine prochaine une vision plus claire de l'impact des mesures que nous avons prises. En particulier les mesures les plus structurantes justement. Donc il faut encore attendre et nous aurons des décisions à prendre dans les prochaines semaines pour ajuster les choses. D'ores et déjà, j'avais annoncé que notre souhait est au moins pour 6 semaines d'avoir ces mesures de couvre-feu.
Und ob diese große gemeinsame Kraftanstrengung etwas bringt im Monat November, das hängt nicht nur von den Regeln ab, sondern vor allem auch davon, ob diese Regeln befolgt werden. Weil vieles sich im privaten Leben abspielt, weil viele Menschen sehr persönliche Entscheidungen treffen werden, wen treffe ich nicht. Und das im Auge habend sind wir auf das Mitmachen und auf die Akzeptanz und das Verständnis der Menschen in unserem Land angewiesen, damit das funktionieren kann.
To curb this second wave of coronavirus cases, the Spanish government declared a national state of emergency that includes an overnight curfew except the Canary Islands. The new state of emergency will last until early May next year.
Comparezco para informar que el Gobierno, reunido en Consejo Extraordinario de Ministros, acaba de decretar el estado de alarma en todo el país y que entrará en vigor esta misma tarde.
WHO chief agreed to the pandemic fatigue that some people were feeling but stressed the need to continue measures to contain a virus for which there remains no cure or vaccine yet. Dr. Tedros warned that the next few months are going to be very tough and some countries are on a dangerous track.
Over the weekend, we saw that while many countries have brought COVID-19 under control, cases in some countries in Europe and North America continue to spike. This is another critical moment for action, another critical moment for leaders to step up, and another critical moment for people to come together for a common purpose. Seize the opportunity. It's not too late.
India is deep in the fight against the COVID-19 pandemic on multiple fronts: medical, social, economic and psychological. India was among the first countries in the world to mandate wearing of masks, use a contact tracing app and deploy rapid antigen test. Timely response helped avoiding a situation which could have led to rapid spread of the virus.
India is the worst hit in the world after the United States in the coronavirus pandemic. However, infections are slowing in the world's second most populous country. India has leaped across several significant milestones in its fight against COVID. With a high number of COVID patients recovering every day and the sustained fall in the mortality rate, India's steady trend of registering dipping active cases continues. India continues to occupy the top global position as the country with the maximum number of recoveries. India has demonstrated an exponential increase in the number of COVID-19 cumulative tests since January 2020. Expanded testing has led to early identification and appropriate treatment. India has continued to report a trend of steadily declining active cases. With focused strategy and proactive as well as calibrated measures of the Union government along with the states and union territories, India has sustained its global position of being the country with one of the lowest cases per million population and deaths per million population. India followed a preemptive, proactive, graded whole of government and whole of society approach to tackle the pandemic. India has taken a science-driven approach in response to COVID-19 pandemic in the country. Such an approach proved beneficial. Various phases of lockdown was done in a timely manner. Also, the timings of the unlock process was done strategically to bring the economy on track. The data for August and September indicates that. In addition to the timely lockdown, India was among the first countries to mandate wearing of masks, use of contact tracing app, and deploy rapid antigen test. Arogya Setu app is an apt example in front of all of us. The entire country stood together to fight this virus. The COVID warriors who are our frontline health workers, knowing well the threat to their life, fought for this country. The government just not restricted itself in saving lives, but also provided safe economy. The government first announced PM Garib Kalyan package to alleviate the suffering of the poor people, the migrants, farmers. To ameliorate the hardships being faced by the people, the government came up with an Atmanirbhar Bharat package. This package addressed issues being faced by all sections of society in all sectors of economy. Free food, grain and pulses to more than 800 million people for 8 months is a program without parallel in human history. After 8 months of COVID-19 and a second wave rising as winter approaches and also the festival around the corner, the start of the festival season in India has been marked by crowds apparently ignoring the dangers of coronavirus. People flock to markets and popular visitor sites, seeming to forget the social distancing guidelines after months of restrictions to counter the pandemic. Prime Minister Narendra Modi in his Mann Ki Baat program advised Indians to show their restraint.
आप सभी बहुत संयम के साथ जी रहे हैं, मर्यादा में रहकर पर्व त्योहार मना रहे हैं। इसलिए जो लड़ाई हम लड़ रहे हैं, उसमें जीत भी सुनिश्चित है। कोरोना के संकट काल में हमें संयम से ही काम लेना है, मर्यादा में ही रहना है।
Scientists around the world hurried into action and took in collective effort to understand where this coronavirus came from and what could be done to stop it. There is no sign of success and the challenges are enormous. Researchers are racing to find a vaccine against COVID-19. Frontline health and care home workers, people with serious diseases, the elderly and the ethnic minorities are first in line to receive a jab.
The overall number of global coronavirus or COVID-19 cases has topped to 47.3 million. The COVID-19 infection has so far claimed more than 12 lakh lives across the world. All eyes are on the development of anti-coronavirus vaccines taking place in various countries. A vaccine that works is seen as a game changer in the battle against the coronavirus, which has killed more than 1.2 million people worldwide, shuttered swaths of the global economy, and turned normal life upside down for billions of people. Hopes of a coronavirus vaccine breakthrough rose after early trials showed a strong immune response in older volunteers. Tests of the Oxford jab also found that people above the age of 55 had lower levels of side effects than younger participants. Experts hail the development as a milestone in the race to secure a vaccination that will help the world recover from the COVID-19 pandemic. The risk of becoming seriously ill with coronavirus increases with age, meaning any vaccination program must be effective in the older population. Interim results from the vaccine produced by Oxford University and pharmaceutical firm AstraZeneca suggest that it produces a robust immune response in the old and the young. In another development, CureVac's experimental COVID-19 vaccine on November 2 triggered an immune response in humans, putting the German biotech company on track to start mass testing this year as the race to end the pandemic heats up. CureVac said its potential vaccine, known as CVnCoV, was generally well tolerated and results strongly supported the company's plan to launch the final stage of testing on humans before the end of the year. CureVac also said that the volunteers developed a level of neutralizing antibodies on par with people who had recovered from the serious case of COVID-19. Authorities in Russia were preparing for mass vaccination against coronavirus by 2021 as the country's second COVID-19 vaccine, Epivac Corona, have proved to be effective. The mass vaccination with the coronavirus vaccine, developed by Vector State Research Center of Virology and Biotechnology, is expected to take place in 2021. For Russian citizens, vaccination will be voluntary and free.
Эффективно работает и вакцина Вектора, и Института Гамалея. Вопрос в налаживании массового производства. Надеюсь, что уже во все регионы эта вакцина поступила. Надеюсь, что к массовой вакцинации мы сможем приступить в конце года.
Bharat Biotech, which recently received approval to conduct phase 3 human trials of India's first indigenous coronavirus vaccine, Covaxin, has said that the vaccine has been found to be safe without any major adverse events in the first 2 stages of trials, and that its goal is to attain strong immune response rate in clinical trials. The indigenous vaccine, developed in collaboration with the Indian Council of Medical Research and the National Institute of Virology, is an inactivative intramuscular vaccine that works by injecting the inactivated version of SARS-CoV-2, the virus which causes COVID-19, into the body to develop an immune response. Recently, Health and Family Welfare Minister Dr. Harshvardhan announced that 250 million people would be vaccinated by July 2021.
We are expecting that early next year we should have vaccine in the country from maybe more than one source, and our expert groups are already formulating and devising strategies to plan out how do we roll out the distribution of the vaccines in the country.
The Hyderabad-based vaccine maker hopes to apply for regulatory approval for the vaccine in the second quarter of 2021. Bharat Biotech had announced on June 29 that it had successfully developed Covaxin in collaboration with ICMR and NIV.
मानवता को बचाने के लिए युद्ध स्तर पर पूरी दुनिया में काम हो रहा है। अनेक देश इसके लिए काम कर रहे हैं। हमारे देश के वैज्ञानिक भी वैक्सीन के लिए जी जान से जुटे हैं। भारत में अभी कोरोना की कई वैक्सीन पर काम चल रहा है। इनमें कुछ एडवांस स्टेज पर है, आशास्पद स्थिति दिखती है। साथियों, कोरोना की वैक्सीन जब भी आएगी, वो जल्द से जल्द प्रत्येक भारतीय तक कैसे पहुंचे, इसके लिए भी सरकार की तैयारी जारी है।
Almost 10 months into a global pandemic, the cause of the new SARS-CoV-2 or the novel coronavirus is still undecided.
On 20th January 2020, millions of people were shocked when they saw this interview on channel CCTV, where one of the known doctor gave a shocking statement.
In the past, we said that it was less dangerous, but now we can say that the virus could spread from human to human.
On December 26, 2019, a woman was admitted to hospital with the symptoms of flu in one of the hospitals in China. And next day, her husband, with the same symptoms of flu, was admitted in the same hospital. While treating the couple, the doctor tested these similar symptoms in their son too. And now, there were 3 patients with similar symptoms. But this could not be a mere coincidence. And so on December 27, 2019, Dr. Zhang, director of that hospital, informed this to higher government authorities in antiquated manner. In coming days, 4 more cases were reported with same symptoms. The biggest question was that the virus was multiplying and was getting transmitted, but there were no serious steps taken by the government. And the doctor told the staff not to bring this news out.
Now the question arises that how this disease came into existence in the world. Is it man-made or biological?
It has been speculated by health experts, scientists and epidemiologists that the virus may have originated from a wet food market in Wuhan, China. The new novel coronavirus outbreak was first reported in Wuhan, China and was traced back to the seafood market, which soon became the hotspot and was considered to be the origin center, where a virus jumped from a bat or a pangolin onto humans. Conspiracy theorists, however, have mentioned multiple times over that the virus is man-made in a Wuhan lab located dangerously close to the wet seafood market. Back in April, a French Nobel Prize-winning scientist Luc Montagnier has also sparked a fresh controversy by making the same claim.
There are many medical strategies, some well known, the vaccine, but less known perhaps boosting our immune system in a non-specific way. Of course, vaccine is a memory for a specific virus or a specific component of virus or bacteria. But in a more general way, if we have a good immune system against anything, it will be good also. And we, medical people, medical doctors, forget about this.
Now a Chinese virologist who has allegedly fled China claims that she has proof that SARS-CoV-2 virus is in fact man-made in a Wuhan lab.
Dr. Li Mengyan, a scientist who was working at the Hong Kong School of Public Health, turned whistleblower on the Chinese government after she alleged that they knew about the spread of the coronavirus before publicly acknowledging the outbreak.
Dr. Li claims that she had to flee to US for her own safety and is now determined to spread her findings to the world.
Dr. Li states that while working at the Hong Kong School of Public Health, her supervisor first asked her to investigate a new SARS-like virus in Wuhan on December 31st, but that her efforts were later stifled. She said she reported back that cases appear to be rising exponentially, but was also told to keep silent and be careful. She also said that she has proof that virus came from a virology lab in the city and not from the wet food market.
I don't want to push anyone to trust me, believe in me. That's nonsense. People can verify, but you have to say both sides.
Yes.
And the thing is, until now, what I feel that I'm happy because I see more and more people realize this is a problem. My supervisor, Liu Peng, he's issued me to do this in secret. So I know he knows, I know Malik knows. But if you ask me whether the dean of the school public health, like Gabriel Liang, knows, I'm not sure because he's not the one directly work with me. But in this secret investigation, Liu Peng warned me and also again repeat to me before and after. He said, you should be careful. Because China government don't want to release these things. So he said, don't cross the red line. I didn't report the man-made part to them because I know I will be killed immediately. I report the cover-up, I report the human-to-human transmission, I report there is no intermediate host, all these things, until 17 January, from late December to 17 January, I keep reporting this, but they have no response. So I know that is an urgent time. After my investigation among all the intelligence and also scientific evidence show me that is actually from the military. So I know this is a thing. I cannot trust WHO. I cannot trust those experts. I definitely not trust Chinese Communist Party.
On the other hand, some sources say that the Chinese National Health Commission, World Health Organization and the University of Hong Kong disputed her claims. In July, Hong Kong University in fact put out a statement which read, Dr. Yan Li was a postdoctoral fellow at the Hong Kong University. She had left the university. Hong Kong University notes that the content of the said news report does not accord with the key facts as we understand them. Specifically, Dr. Yan never conducted any research on human-to-human transmission of the novel coronavirus at the Hong Kong University during December 2019 and January 2020. We are not just fighting an epidemic, we are fighting an infodemic, said World Health Organization Director General. As the virus has spread, so has misleading, inaccurate and downright untrue claims about it. One of the most persistent has been the suggestion that COVID-19 is a man-made bioweapon. Sometimes, these claims have been able to flourish because the virus is so new that scientists simply do not have hard enough evidence and corroborated research to dismiss them. But some researchers, doctors, politicians and intelligence services around the world are convinced that COVID-19 evolved naturally. They have studied its makeup, its behavior and other contexts to make their conclusions.
The future of COVID-19 depends greatly on arrival of a vaccine. As scientists grapple with the challenges presented by the coronavirus as uncertainty, confusion and anxiety surrounds the pandemic, the race to find a vaccine is still on and countries have come together to collaborate in this field. Researchers are still coming up with terms of new information and data that throw light on the real picture.
The future of COVID-19 depends greatly on the arrival of a vaccine. As scientists grapple with the challenges presented by the coronavirus as uncertainty, confusion and anxiety surrounds the pandemic. The race to find a vaccine is on and the countries have come together to collaborate in this field. Researchers are still coming up with terms of new information and data that throw light on the real picture, while the world waits for the good news. Around the world, epidemiologists are trying to find a way to mitigate the spread and impact of COVID-19. The virus continues to spread and intermittent lockdowns have become the new normal. The projections and forecasts by scientists regarding control of the virus vary, but specialists agree on one point, that COVID-19 is not going away in near future and we are in a pandemic situation for which we have no precedents as it does not follow the pattern of pandemic flu. Amid the uncertainty, it's gradually becoming clear that the future depends on whether people develop lasting immunity to the virus and what kind of preventive measures people continue to follow during increased social mixing. Recent models by epidemiologists and evidence from successful lockdowns suggest that behavioral changes can reduce the spread of COVID-19 if most people comply. A team of researchers concluded that if 50 to 65% of people are cautious in public, then stepping down social distancing measures every 80 days could help to prevent further infection peaks over the next 2 years. Data from 53 countries beginning to open up show that there hasn't been a large surge in infections, as predicted based on earlier data. Scientists say that behaviors can make a significant difference in disease transmission. To end the pandemic, the virus must either be eliminated worldwide, which most scientists agree is near impossible because of how widespread it has become, or people must build up sufficient immunity through infections or a vaccine. It is estimated that 55 to 80% of a population must be immune for this to happen, depending on the country. The World Health Organization lists more than 24 of COVID vaccines currently in human trials, with 12 in phase 2 trials. Given the sheer amount of effort and money pouring into research for vaccine, one can hope that soon we may witness an effective outcome. Though producing it on a large scale and distributing it to vulnerable populations might prove to be a Herculean task.
That's all we have in this edition of a special report. Thank you for watching. Goodbye.